people who registered for this event. I am Jan Beattie. I'm professional advisor in the Scottish Government working in dementia policy, and I'm going to steer us through this afternoon today. A few bits of housekeeping before we start, just to keep us right. Can I ask that everybody switches off their camera, and just because of the large numbers, and keeps themselves on mute in time-honoured fashion that we've all learned, unless of course you're speaking, in which case we want to both hear you and see you. We are recording this session, so we will switch on record just as soon as I'm done with the housekeeping. I'll just say press record at that point. We have a quite a busy schedule this afternoon, so we have briefed the people who are presenting on their time to give time for questions after each speaker. So if you can let people do their presentations and then either raise your hand or put your question in the chat box, we'll try and get through as many as we can. And if we don't get to you during the session, we'll certainly get back to you after it as well. I think those are the domestics, so I think we can press record now. Oh, it's already started. Great. I'm absolutely delighted to be chairing this session. It's been my absolute privilege and pleasure to have worked with the co-chairs of the National Dementia Housing Forum, Ashley Campbell and Leslie Palmer, who are talking later this afternoon, to work on what the output is, the report, but the process of this work has been a really fantastic piece of work over about a year and a half. The report was launched last Thursday in Hanover, Scotland's Varus Court in Forres. I think we could say it was a gold standard housing for people living with dementia, at the same time as the new Scotland's National Dementia Strategy was also launched. So the work is starting on that as well. And it's no coincidence that that announcement about Scotland's new National Dementia Strategy was made at the launch of this report, because housing will be much more front and centre to our next strategy than it has been ever before. So without further ado, I'm going to hand over to our first presenter. If I could just, a quick reminder, if you wouldn't mind switching your cameras off and staying on mute unless you're speaking, that would be really helpful. We've still got a couple of folk on. Thanks very much. So I'm going to hand over just now to Angela O'Brien, Head of Housing and Independent Living at the Scottish Government, who's going to take us through some of the Scottish Government's plans just now. Over to you, Angela.
Thanks, Jan. I'm actually struggling to get my camera to turn off. There we go. There we go. Thanks very much, Jan. Good afternoon, everyone. And thank you to Ashley and CIH for the kind invitation to speak at this afternoon's event. I'm Angela O'Brien, and I head up the Housing and Independent Living team at the Scottish Government, and we've been really pleased to be involved in the work that resulted in the Living Well at Home report, and I'm hoping just to take a very quick run through some of the things that are happening, particularly on the housing side, but also a bit more broadly than that, in terms of what the Scottish Government is working on around helping people living with dementia to live well at home. Now, I'm not sure if I need to share my screen or if my presentation is going to come up. I'm not 100% sure.
Angela, what would you prefer? I've got your presentation here. I can put it up for you, or you could do it yourself.
I think that would actually be helpful if you could stick it up for me, Ashley. Just save me worrying about dodgy connections at this end, that would be great. Thank you. So probably that's perfect. Thank you very much. Can probably move on to the second slide. Thanks.
Just got a wee delay here.
Thanks. Well, start with Housing to 2040, which many of you on the call will be aware of what's in Housing to 2040. It's the Scottish Government's strategy. The name basically summarises what it says. It's the government's route map for housing to the period up to 2040, and it is the long-term strategy. It sets out the vision that government wants Scotland's homes and communities to look like in the period up to 2040. Just to summarise some of the detail that's actually in the document, it was developed following extensive engagement with the housing sector, lots and lots of other stakeholders, including disabled people's organisations, third sector organisations and the public, and it sets out the vision, as I say, for what Scottish ministers want Scotland's homes and communities to look like by the end of 2040. It's a vision where the aspiration is that homes are affordable for everyone, where standards are the same across all tenures, and where homes have easy access to green space and essential services. Actions cover a broad range of housing activity, and achieving the outcomes identified within Housing to 2040 will need effective partnership working both across government and the housing sector and well beyond. This is not something that government can do by itself, and I think ministers are very clear on that. The governance process for Housing to 2040, which did get caught up a wee bit in the everything that had to be done in relation to the COVID pandemic, has now been approved, and meetings around that will be starting in the autumn. There's going to be a two-tier structure with a strategic board that's jointly chaired by the Cabinet Secretary and COSLA, and then there'll be senior housing stakeholders involved in that group, and then there'll be more of a sort of working group at official level, which will also have a wide range of stakeholders, as well as Scottish Government and COSLA involvement. Maybe could move on to the next slide. Thank you. So to focus on the specific actions within Housing to 2040 that relate to independent living, and what this might mean for people living with dementia, and more generally for people who want to live independently at home for as long as they can. There's a whole range of things that are either happening or are planned. Government wants, as we all know from the Living Well at Home report, the government wants people living with dementia in Scotland to have choice, dignity and freedom to access suitable homes that have been built and adapted to help them live and participate as full and equal citizens. As you know, local authorities are the statutory housing bodies, and they have responsibility for planning for and meeting housing needs, and these are set out within their local housing strategies, and that also should include and does include information about how the identified local needs will be met. I think it's very much recognised that the best way to identify needs is at that local level, where people have a real understanding of the communities and what their requirements are. Within Housing to 2040 itself, the specific actions around independent living includes, as it says on the slide, work that's very much ongoing around reviewing Housing for Varying Needs, which is our design guide for accessibility for new social rented homes. And anybody who has had experience with Housing for Varying Needs, you'll know that it's been in place for quite a long time now, and although it holds up quite well, it's been in need of review for a few years, and that work is actively ongoing, and there'll be a open consultation on that happening in the near future. Other things that we are very much focused on is around increasing the supply of accessible and adapted homes and improving choice for older and disabled people so that they can access the right home at the right time. Following on from the review of Housing for Varying Needs, Scottish Government will also be introducing new building standards that will underpin a Scottish Accessible Homes Standard, that work will be from 25-26, and that new Scottish Accessible Homes Standard will be for all new homes, whatever the tenure. So private sector as well as social sector housing will be expected to achieve those standards, and we appreciate that there'll be a lot of work that will need to be done with a wide range of people getting involved in that to make sure that that's something that is useful both to people who need accessible homes, but also to private sector builders, developers and other people, so that they understand what's needed, why it's important, and so that we've got usable building standards that everybody's signed up to. More recently, we've issued new guidance to local authorities around the delivery of wheelchair accessible housing, and that includes, again, setting targets that are across all tenures, and councils are working on reports that will have to be delivered annually around those targets, explaining how many accessible homes have been delivered in their area, where they are, what they are, which will definitely be very useful. We're also working with our colleagues in health and social care around the adaptation system, which we know could work better than it does, and there's work going on there to look at the system and to look at how we can fundamentally make that a much more user-centred, user-friendly system for people to access and get the adaptations that they need when they need them. And more broadly, working again with colleagues in health and social care around embedding a person-centred approach that aligns housing with health and social care services, and I'll come on to it a bit later, but also in relation to the new National Care Service. Can maybe move on to the next slide, please. Sorry, I think we've jumped. Can maybe jump back? Sorry, I think I've jumped ahead a bit. Apologies for this. Okay. And more broadly, Housing to 2040 has 4 key themes. More homes in great places, which is all around the Scottish Government's programme for government commitment to deliver 110,000 affordable homes by 2032 at least, which 70% will be available for social rent, 10% of which will be in our remote rural and island communities. Housing to 2040 is also connected well into the work around town centre living, and investing in a rolling programme of demonstrator locations to try and support town centre living and the 20-minute neighbourhood model. Again, I'll come on to that in a wee bit more detail. We're also working on developing a remote rural and islands housing action plan with communities and key stakeholders in our remote and rural communities, which will set out how to meet the housing needs and retain and attract people to those communities. And that also connects into some of the actions around the draft National Planning Framework 4, which encourages that development that will help support and sustain rural areas. Next, affordability and choice. A lot of folk here today will be aware of the draft rented sector strategy, which sets out the government's plans around improvements that we hope to make around supporting the private rented sector, both to help organisations, businesses that work in the private rented sector, but also in terms of people who rent, to make sure that the sector is working as efficiently and effectively as it can. And that will include the creation of a tenant participation panel to make sure that there's a strong connection between the people living in the private rented sector and the development of that sector. Additionally, there's broader work that's actually happening around creating a right to an adequate home in Scotland, and that fits in with the broader work that the Scottish Government's doing around human rights. There's also funding made available to do things like support the Gypsy Travellers community, which is obviously one of the most disadvantaged communities in Scotland. And we're also looking to work with local authorities around enhancing the empty homes system. And finally, stuff around quality and zero emissions. I think we're looking to make sure that Housing to 2040 is properly connected into all the work that's happening around the need to achieve net zero. And we're working very closely with our colleagues in energy around that. And within that, looking at work around tackling fuel poverty, which obviously is absolutely the hot button issue at the moment in terms of the cost of living crisis. So the fuel poverty strategy was actually published last December, and I was involved in that, and it does seem like a world away, but there's a lot of work being done around how we make sure that investment, the significant investment that's going into making homes in Scotland more energy efficient, is actually also helping people manage their energy bills and dealing with some of the issues that people are facing around heating and other issues with their homes. In addition to that, Housing to 2040 has big section around improving the quality of all homes, where there'll be a new housing standard, and this is for existing houses, which again will cover all homes, new or existing, and it will also include properties which in the past perhaps have always been considered as mainstream housing, so things like agricultural properties, mobile homes and tied accommodation, and this links back into the right to an adequate house, and that new housing standard will look to go beyond a minimum standard to make sure that homes are free from serious disrepair and that there are minimum space standards, looking at things like digital connectivity, which obviously is really important to make sure that people are connected as we move forward, so that they can access the services they need in that way. And basically, the purpose of Housing to 2040 is to ensure that by the time we get to 2040, people have access to a home that meets their needs. It's good standard and it covers all housing tenures. If we could move on to slide 4, thank you. Great. Just really to make the connection between housing and the new dementia strategy. We'll be looking to work with our colleagues, Jan and her team, who are leading on the strategy, to make sure that the connection between all the actions that are within Housing to 2040 and the new dementia strategy is live and active, and we're taking account of feedback that's coming in as the team are working on that strategy and developing it. Great. Slide 5. Thank you. I touched earlier on the importance of placemaking. Living well at home is also about the place where your home is, and how does that place and the house help someone living with dementia. Commitment 6 of Scotland's Dementia and COVID action plan recognises the evidence that staying at home can help people living with dementia achieve their best health and wellbeing outcomes, and making that ensuring that we're maintaining that community connection to the wider community is a critical part of that. We know that certainly at the moment, around 65% of people living with dementia do so living in their own homes, and that the place and places where we live can have a direct impact on our health and well-being and on the environment, and that can have an enormous impact on the quality of our lives. So the Scottish Government is fully signed up to the principles around the 20-minute neighbourhood, which is all about creating the conditions for people to live well locally, and to be able to access services locally, everything they need within basically a 20-minute radius of where they live, on the basis that that creates the conditions for people to live well locally, with benefits for people, for the place, and also more generally for the planet. It's not a new concept, but I think we all know that the pandemic has pressed home the importance of place and the need to ensure that people and communities are well connected, and that those communities are well serviced, so that it keeps a momentum around the concept of living local, which fits very much into the concept of net zero as well. The idea is that 20-minute neighbourhoods are attractive places that can be walkable if people are able to do that, but in other ways are easy for people to get around, and that people of all ages and ability can live in sustainable surroundings. So on that basis, colleagues of ours are working towards making sure that that's the norm as far as possible, and how that connects into the draft National Planning Framework 4, and how that also relates to what might happen in terms of housing for older and disabled people. NPF 4 does reference the fact that there needs to be more done to ensure how the planning, to ensure that we show how the planning system will meet the needs of older and disabled people. And I think at the moment there's quite a bit of work being done to make sure that the connection between everything that's in Housing to 2040, which will help deliver that, is properly connected up into NPF 4. As I understand it from our planning colleagues, the intention is that NPF 4 will be laid in Parliament for scrutiny in the autumn. So it's something that's very live and happening at the moment. Can we move on to slide 6, please?
Angela, Chair here, could I just jump in with a time check? You've
Yes.
got a couple of minutes left, and that includes
Great.
time for questions. So just, 3 minutes left, including any questions. Thank you.
Okay, thanks, Jan. Obviously, I'm covering the entire Scottish Government stuff, not just the housing stuff. So just a couple slides to go, and I'll be very high level about these because I think other folk may pick them up. Colleagues who are taking forward the National Care Service bill asked us just to flag where they are with things. So I won't go into the detail. You'll know the bill was laid in Parliament just before the end of the last parliamentary session, and people will know that the intention is to develop a national care service that basically removes any potential local barriers, and that it's a single route of access for people, so that you've got the same quality and type that meets your needs regardless of where you live in Scotland. And finally, the carer strategy, just very quickly. Again, colleagues who are dealing with the development of the National Carer Strategy asked us to flag as well. They are developing the National Carer Strategy, looking at COVID-19 recovery and improving carer support. Obviously, there's a huge amount of feedback on the issues that unpaid carers have experienced during the pandemic and beyond. So there's a lot of work being done around that. And from a housing perspective, and particularly from a housing and independent living perspective, we'll be connecting into that work and looking at how we can maximise how all the commitments around making housing suitable for people works with their carers, to make sure that they, again, to go back to my original point, that by the time we get to 2040, people can access a house in the right place that meets their needs, and within that, being able to meet the needs of their carers will be part of that. So that's my final slide, and I'd be happy to take any questions or comments, whether right now or if you route them through Ashley and Jan, we can pick them up and route them to the right people and get back to you. Thanks very much.
Thank you very much, Angela. As you say, that was a lot to cover in quite a tight time scale. We literally have 30 seconds for questions. So I think that we're only going to have time for one question. Please put them in the chat if you have anything else. But Jim, I see your hand up.
Thanks, Chair. Just a quick one. First of all, thanks for the presentation. Very good. Costings for this. Has the government considered how much this is going to cost? And are they making specific budgetary provision for it?
When you say how much this is going to cost, Jim, obviously Housing to 2040 has been costed. Everything else that I covered, I can pick that up with the relevant colleagues and come back to you on it.
That's fine. Thank you. Thank you.
Thank you very much, and thanks again, Angela. And sorry, folks, but I'm going to be a bit of a bossy chair here, and try and get as much to time during the afternoon so that everybody who's presenting gets their time. Thank you. I'm going to move on now to bring in Ashley Campbell and sorry, just Ashley Campbell and Leslie Palmer. I thought I just mixed your second names up there. Who, yeah, as I've said, it was my pleasure to work with over the last year and a half or so. Over to you both. Thanks.
Jan, I'm just gonna get my slides up. Give me just 1 second. Okay, thanks. As Jan said, I'm Ashley Campbell. I'm the Policy and Practice Manager at CIH Scotland and co-chaired the National Housing and Dementia Forum with Leslie. I'm going to go over a brief kind of run through of how the forum was established and how we gathered evidence, and then I'm going to hand over to Leslie, who's going to talk about the recommendations in the report. And since we've only got 10 minutes, we best get on and make it quick. So as you just heard from Angela, going through some of the Scottish Government strategies, the National Dementia Strategy ran from 2017 to 2020, and at that point it usually would have been due to get renewed, but obviously COVID came along and that required something a bit more urgent to make sure that people could still receive the care and support they needed throughout the pandemic. So as Angela mentioned, the Scottish Government published an interim COVID-19 action plan, and that included this commitment number 6, which sort of reiterated a long-standing Scottish Government commitment to support people to live well at home or within a homely setting for as long as possible within their local community. So that's really trying to ensure that people avoid admission to residential care or into hospitals. And on the back of that commitment, the Scottish Government, recognising the importance of home in supporting people with dementia, invited myself and Leslie to create a Housing and Dementia subgroup, which then became the National Housing and Dementia Forum. So that's just a wee quick slide there showing you where this sits in amongst all those different strategies. The Housing and Dementia group was one of 5 different subgroups looking at different aspects of dementia and dementia care in Scotland. So Leslie and I set out some objectives for the Housing and Dementia Forum. We wanted to develop an understanding of what housing is available for people living with dementia in Scotland now. Was it suitable to meet existing needs? Was it suitable for people's future housing aspirations? We wanted to understand the different ways that people are accessing housing options, support, advice and information, and what the barriers might be to people getting the support and the advice that they need. We wanted to better understand the relationship between housing, health and social care. As Jan mentioned at the start, it's really important that we get housing embedded within the National Dementia Strategy to make sure that that's really front and centre. We wanted to understand the different factors that people face on their housing journey. So at the point of diagnosis and beyond, how do they approach decisions regarding their housing, and how do they decide to make a move in later life if that's what's right for them? We were really sure that we wanted to develop outcomes and recommendations that were tenure neutral. As Angela noted before, the majority of people with dementia are living in their own homes. They're not living in specialist care homes or in specialist housing. They're living in communities, and a lot of people own their own homes as well, so they might not have access to the same kind of advice and support as social tenants. And we wanted to increase awareness of dementia among housing providers and the housing workforce, and increase awareness of the role of housing in supporting people with dementia. So these objectives were written into the remit of the National Housing and Dementia Forum. So in running the forum, we wanted to make sure that we got input from as wide a range of people as possible. And during the pandemic, that was really the real way to do that was via online sessions. I think we spoke to a range of about 60 individuals and organisations altogether. That was a mix of housing and built environment, academics, health and social care professionals. We spoke to the third sector, and we had separate sessions for people with lived experience of dementia as well, to make sure that they could have their say and have the space to bring their experience to the group as well. We held 4 themed evidence sessions throughout 2021 and 2022, and we fed the information from those sessions back to a steering group just to kind of sense check what we were hearing from the evidence sessions. If it became clear that we needed to delve a bit more into a topic, or if there's something missing from our evidence sessions, we held additional follow-up interviews with individuals, and we also held a session with the Inverclyde Care Coordination Project. Throughout the process, Leslie and I also co-authored blogs and published those online to keep people up to date with the progress of the forum and what we were hearing through the different evidence sessions. And I'm just going to give you a really quick run through of some of the feedback that we got through those sessions before Leslie goes on to talk about the recommendations of the report. As I mentioned, we heard from people with lived experience of dementia, so that's people living with dementia, their families and their carers. If you haven't seen the report yet, it's available online, and throughout the report we have used these characters or personas to demonstrate some of that feedback that we had. We haven't quoted anybody directly, and these characters are an amalgamation of all the different experiences that we heard through the forum, and kind of demonstrate the different kind of challenges or issues that people might face throughout their diagnosis and throughout different stages of their housing journey. So we picked 3 different housing types and 3 different experiences. Margaret is a homeowner, and she's living in her own home. Frank is a housing association tenant living alone. And John is living in a council house with his partner, Jim. So it's a really kind of wide range of experiences, and they're sort of reflected throughout the report. So you should see that when you're reading through the recommendations of the report. And I mentioned that we had 4 themed evidence sessions online. I won't go through this in detail because we don't have time, but there's further detail in the report if you want to go and have a look at it. Our first online session focused on housing options and adaptations. We heard, as Angela reflected, that there can be a real inconsistency across different tenures because people are living in communities, they're not living necessarily in specialist housing. For example, somebody living in the private rented sector might find it quite difficult to ask for an adaptation or to find out where they get funding for that, because the system is quite complex. Some people mentioned a lack of choice, which could create barriers to adaptations, people not wanting their home to look too clinical, or maybe having financial barriers in place. And there's still a real stigma associated with ageing and discussing our changing needs as we grow older. The second session was on access to advice and information, and we heard that there's loads of information out there, but it's not always easy to access. People might not know where to go for help, and it's in different places for different people. And really, really important point is that we need to have earlier discussions about housing needs, probably as part of the post-diagnostic support stage. Not necessarily saying that people need to take action straight away. You don't need to think about moving home or major adaptations, but if you have discussions early on and start thinking about what you might need later, it makes it a lot easier to deal with. The third session was about support for people living with dementia. And again, this was a recurring theme throughout the different groups, that not everybody had equal access to support. So if you had a social landlord, you're much more likely to know where to go to ask for help than somebody who was living in the private sector. Third sector organisations provide really amazing support, but often their funding can be quite short term, it can be quite inconsistent. So it's difficult to provide long-term support that people need. And people really value peer-to-peer support and people with that lived experience. And the last theme that I'll just go over briefly is moving home in later life. So we wanted to understand what drives decisions or what kind of barriers there are for people who do decide to move home. We found that planning is often delayed by stigma. Housing is very personal, especially if it's a family home where there might be a lot of memories attached to the home. And so it can be difficult to make that initial decision. But even beyond that, the practicalities of moving home, so arranging for removals, the costs can create barriers as well. There might be limited choice of housing in the local community and beyond. And the private housing sector isn't really catering for people's needs. They're not building the types of home that older people might necessarily want to live in or can afford to live in if they want to move. So that's just a really brief overview of some of the evidence that we heard. I'm going to pass over to Leslie now to go over the recommendations from the report.
Thank you, Ashley. So reflecting the Scottish Government's vision for housing for 2040 and its commitment to embedding human rights principles, including the right to adequate housing, our recommendations are that the Scottish Government really must ensure that people living with dementia, their families and carers have access to housing and to information and advice and support based on their individual needs, and that people should be able to access this support irrespective of and without any discrimination of their housing tenure, their personal or financial circumstances. Next slide, please, Ashley. Our specific actions. Next slide, please, Ashley.
All right, there's a wee delay, so I've clicked.
Okay, thank you. I'll be patient. The specific actions that should be taken to improve the outcomes are across 5 categories. The first 4 reflect the evidence sessions that Ashley has introduced you to. But the 5th one was in respect of housing standards and design. Design was a recurring theme that came through all of the evidence sessions, and we felt that it merited separate actions. In addition to providing recommendations, we have also identified relevant stakeholders, cohorts or organisations who we feel have the responsibility or the opportunity to implement those actions. Next slide, please, Ashley. What I'd like to do now is just take you through the 5 themes of recommendations and highlight a couple of those and what outcomes we were hoping to achieve from them. So under the theme of housing options and adaptations, this one really focused on understanding what housing is available for people living with dementia and what adaptations are required now and are going to be required in the future. And as part of that recommendation, we felt there needs to be developing methods for data collection so that we can understand where people with dementia are currently living, what type of housing are they in, and what options and numbers of suitable homes are available to them now and in the future, looking at population projections. We also recommended ensuring there are appropriate skills in collecting this information across our link workers or occupational therapists and social workers, really to ensure that we have the capacity to be able to collect the relevant information and inform future decisions. We also recommended streamlining and adequately funding the adaptations programme across all of the tenures. As Ashley mentioned earlier, some people within the private rented sector find it more challenging to access adaptation funding than those who have social housing. The adoption of the outcomes within the housing and options phase we felt would provide better intelligence to enable the Scottish Government and local authorities to make more informed decisions and to improve the housing options going forward. And also that they would ensure that people who are diagnosed with dementia receive timely information about the housing options or where they can access help in the future if their needs change. And we also felt that it would provide homes that can be much more easily adapted to meet a range of different needs as the person's age progresses and the disease progresses as well. Next slide, please, Ashley. The second theme has a focus around access to advice and information. There was many recommendations within this section, so I'll just pull out a couple here. One of the key ones is that we felt there's a need to commission a national conversation on housing in later life in order to tackle the social stigma and encourage the nation to consider how fit their home is for their potential future needs. We wanted to do that, and in addition, we also wanted to increase awareness of the challenges of having dementia and the needs to find suitable, appropriate housing amongst all housing providers, and to integrate assessment of housing suitability within post-diagnostic support. So with our commitment to provide 1-year post-diagnostic support for anybody who receives a diagnosis of dementia, we felt there was also an opportunity to widen that support to include the housing conversation and looking at adaptations and support as part of that. We also feel that there's an opportunity here to create a dedicated platform. There's a lot of information available to people online, but there's no one-stop shop to go to provide support if you receive a diagnosis, to support you considering your housing options going forward. We envisaged that the application of these recommendations would help to normalise conversations around housing and ageing, ensuring that people know how and where to access information, what advice they're going to need going forward. We also felt that it would help people to plan for the future and avoid having to deal with housing crisis and health once their health has deteriorated. We saw through the evidence that most often people move in later life at a point of crisis, and we wanted to create a timeline that people could gradually adopt and consider their housing options as they age. We also felt, most importantly, that it would increase agency for individuals to make their own decisions and help address this imbalance currently experienced between people living with dementia in different tenures. Next slide, please. Under the third theme of supporting people living with dementia, the recommendations here really focus on understanding and improving the relationship between housing, health and social care partners and other forms of support. One of the key recommendations is promoting equal partnerships between housing providers and health and social care partners when specialist housing has been funded. Currently, there's an imbalance in relation to contract commitment or longevity of a contract provision between the housing providers and health and social care partners. And a balancing of that would enable us to provide more supportive specialist housing where you have housing and care provided together. We also felt that there was an opportunity to develop a standardised approach to adaptations assessment and funding across local authorities, recognising that there are variations in how people are being assessed and funded. We also recommended widening access to self-directed support and encouraging the Scottish Government to continue to invest and expand on the post-diagnostic support commitments that we have there, and including housing within this conversation. The actions around this we feel would improve the outcomes for people living with dementia and their families by ensuring that services are better connected and available to them. Next slide, please. We considered the moving home in later life and the scenarios that trigger a move or the desire to move later in life. And our recommendations focus here on understanding what those causes are and the journey that a person has from moving from one type of accommodation to another, and how they can be better supported through those journeys. Quite often we saw the move was from their home into an acute admission as a result of a fall or an injury, or from their home into long-term care. And we wanted to create an opportunity there for people to, again, be an agent in that and forward plan for any potential desirable moves. The recommendations within that are about commissioning further research into housing aspirations of older people, assuming that we are all heterogeneous with different views and different likes and desires about our housing going forward. So not wanting to homogenise, make any assumptions about housing provision going forward. But naturally, we recognise the need to increase supply for older people and having housing which is appropriate for older people, and to provide practical support to right size or to move home at those journeys, and to build knowledge of existing local services that people can access now, because there are services there to support people through that. We felt there was also an opportunity to develop positive working relationships between housing, health and social care to ensure that staff are always aware of each of their roles and responsibilities within housing. And one of the common things that was said through the evidence session is that housing is everybody's issue, and we all have to acknowledge this and play a role in being able to support people with dementia. The actions within this section we feel would improve the understanding of the housing needs and the aspirations of older people in Scotland, ensuring that we have suitable homes, that these are being provided and that they're being provided in the right locations. We also feel that adopting these outcomes would provide practical support for people who want to move, therefore reducing delays and helping people to move when they need to and when they want to, preferably. Next slide, please, Ashley. So the last set of recommendations within this focused on housing standards and design. This was really the technical application of the evidence and the recommendations that we heard, and that acknowledges the already established evidence base around environmental design for people living with dementia and for ageing. And what we're doing in this is making a series of recommendations to embed dementia and age-friendly design principles in our Scottish Technical Building Standards, including the ongoing update of the Housing for Varying Needs and Lifetime Home Standards, to ensure that our homes that are being designed now are suitable for the future and for people's future needs as well. We want to engage national house builders to understand the barriers and opportunities that they have to develop housing suitable, and those that follow the ageing and dementia design principles that I've mentioned earlier. We want to improve and also understand the private rental sector's challenges and opportunities, and I want to improve knowledge within the private rental sector of the legal obligations that they have to make reasonable alterations and adjustments and adaptations to people's homes. And those actions we feel really improve the quality of housing to support common complaints of ageing and build resilience in our national housing stock to be able to support the changing needs of an ageing population, which in turn will really support people living with dementia to remain independent within their own home for longer and support people living with dementia to return home following admission to hospital. Next slide, please, Ashley. So just to summarise, the report has now been published. It was launched on the 18th of August at Varys Court, and it's available online. And here's a link to everybody, and perhaps we could drop that into the chat so people can download that as well. The National Dementia Strategy is now being revised by the Scottish Government, and Ashley and I really hope to see recommendations that we've made through this report reflected in that new strategy. So thank you very much.
Thank you very much, Ashley and Leslie. We're actually bang on time, but with no questions. There's I think, Jim, yours is a legacy hand, so there aren't actually any hands up, but there's a question in the chat box from Fiona, which I'm going to ask Leslie probably to respond to in the chat box or as a follow-up, because as I've said, I want to give everybody who's presenting their time today. So I'm actually going to move us on, and hopefully we'll have a wee bit of time at the end for any outstanding questions. But one of the places that we did a particular focus discussion on around this that was highlighted there was Inverclyde and their care coordination demonstration project. And Debbie Maloney was a fantastic source of knowledge, experience, insight and learning. And I'm going to hand over to Debbie right now to take us through some of what the local learning in Inverclyde has been that we were frankly blown away by. Over to you, Debbie.
Thanks so much for that. A lovely introduction. Ashley, are you able to share my slides, please? Thank you. Okay, again, thanks very much for this opportunity this afternoon to tell you a wee about some of the work we've been doing in partnership in Inverclyde around housing and dementia. Next slide, please, Ashley. This will be a wee whistle-stop tour of our work, but I'll touch on our project with his focus on dementia and the importance of housing in this work. Some of the tools and resources we used, work with our housing strategy team, some examples of our work, and summary and some learning of our work. Ashley, next slide, please. As part of the background to the work, I have to go back to June 19 when we launched our focus on dementia work in partnership with HIS and Alzheimer's Scotland. The focus on dementia team worked collaboratively with Inverclyde Health and Social Care Partnership and worked between June 19 and March 22 to support the redesign of our dementia pathways from point of diagnosis to end of life and to share learning across Scotland. This work included many local stakeholders. As part of the work around our launch of the Focus on Dementia project, we held a stakeholder event to launch the work. One of the key themes, I'm delighted to say, was identified by people who attended this was housing and how it plays such an important part in living well with dementia. Housing was seen as an important aspect across the whole housing dementia pathway. However, it was imperative that for the best outcomes we had housing discussions as early as possible. As from experience, we were moving people at points of crisis, and it was so nice to hear Ashley and Leslie's work. Like, yeah, same themes. Points of crisis rather than planned way, which with people and their family who experienced dementia was not the best experience. Ashley, next slide, please. So the work aligned itself beautifully to the 5 outcomes of Scottish Housing and Dementia Framework, where people receive valuable housing advice when they need it, that their homes have been adapted and designed to suit themselves and support them to stay at home. They felt listened to and involved in decisions that mattered to them, and they know about the housing choices and feel able to plan for the future and are supported to live well and safely within their community.
We also promoted this work through our housing partnership groups to encourage all our local registered social landlords to sign up to the pledges around this work. Ashley, sorry, next slide, please. It also fits beautifully with our housing solutions work. It fitted very well. So as we've touched on that, where Housing Solutions is a training that's rolled out across all housing and health and community staff to have early conversations around future planning for housing needs. There's a strong emphasis on early intervention, exploring the simplest of solutions, considering the housing opportunities and personal outcomes, and just having that discussion about, have you thought about what your future in this home might be, and how you're going to manage your garden, and how there's no local transport and all of that kind of, just in conversational context, important things. So the objective is to stimulate earlier discussions around changing housing needs and help people consider rehousing before a crisis occurs. Key triggers and considerations for the identification and provision of different solutions, including housing options, technology, equipment and adaptations. Our aspiration was to roll the housing solutions training, across all health, housing, third sector and social care agencies in Inverclyde. Not there yet. On a practical level, our work plan tasks our housing occupational therapists to work with our post-diagnostic link workers who gave training on housing solutions. And this allowed consideration of planning for the future at the point of diagnosis and ensuring that people have the information to help them make appropriate decisions, and also where to come when it's time to link back in. Ashley, next slide, please. As part of the work plan on Inverclyde Housing Contribution Statement, a specialist housing review was commissioned. Our housing strategy section supports this work, and one of the key areas identified is dementia as part of this work. The recommendations of this work will feed into the work of our next housing contribution statement and aspires to look at allocation of any new build or opportunities relating to the acquisition programme for this service user group. Our housing colleagues in Inverclyde Homes, when developing the site at St Stephen's in Port Glasgow, included a block of flats that was specifically designed to support people with dementia. This was a fantastic piece of work, but with everything there was a bit of learning. And the main things we learned were, in case it's helpful, earlier joint working at the design stage with the Health and Social Care Partnership. The wider implications, and this came kind of, and I should have seen it coming in from the side, the wider implications around care provision in the locality. So we built in Port Glasgow where we were already struggling to recruit home care staff, and we put people in there who have high level need, which was a bit of a struggle for our care home services who work in locality patches. It was one that came quite left field, and I should have seen it coming. So I've popped it down here in case it helps anyone else. Not one size suits all. That's just the tradition, the nature of people's conditions. And around allocation, the balance between the kind of bespoke needs and the timeline of building. Often the people we had identified in occupational therapy as being suitable for this accommodation in terms of nomination, it wasn't suitable by the time the building was complete. So it was about getting that right. And also tech solutions could be considered earlier. Ashley, next slide, please. So as part of the work around supporting people within Health and Social Care Partnership in Inverclyde, we were working with our Inverclyde sheltered housing wardens. The work was really to embed a enablement approach into practice and to demonstrate alternative ways of support and leave a legacy of increasing tenant-led activities within the complex and out within the wider community. It was really important that we moved away from the traditional model of sheltered housing. Some of our planned change ideas were to train our sheltered housing colleagues in supporting independent living, care planning, goal setting, and have mechanisms in place to ensure that we measure people's outcomes against their goals. We're really keen to support identifying what older people's assets were and any opportunities associated with these. And as part of our monitoring around sheltered housing, we put in place asking the wardens to give us some really good practice work around that, and their stories were phenomenal or people who played the piano and wanted to teach others, or people who, there was even a group in down in Greenock who dug a whole load of holes in the front garden of the sheltered housing and made a wee mini putting because there was some keen golfers in there. But those stories would have been missed around, you know, taking people's assets and what their skills and interests are, and thinking outside the box a wee bit. We wanted to make sure that our within those complexes, our wardens were really proactive in keeping the resource relating to the local activities in the community, and to share the learning and resources across all our sheltered housing complexes. We wanted to create a dementia-friendly communities within the complexes and the surrounding neighbourhoods, and some awareness training in the community, and make the best use of technology. I'm speeding up now, right? Sorry, Ashley, next slide, we're nearly there. Okay, so in summary and learning for us, it's very important the role that housing plays in supporting people to live well at home. We all know that. Housing solution opportunities across all, and embedding the ethos that housing is everybody's business is where we're going. The programme is being rolled out, but it was being rolled out by colleagues at the iHub, and we have trained a few trainers in this approach, but we need to up the game on that and push it back out now that we're not so focused around our COVID interventions, and we can get into much more easily in face-to-face training and tech training around this, and have those conversations. The housing conversations will help us with earlier implanting the seeds that can, and so we can work together to find the best solutions and suitable housing to reduce expensive adaptation costs and creeping adaptation costs as people's health deteriorates in inappropriate housing, and also to look at freeing up some family accommodation that's under-occupied and ensure that there is planning so as people are not moving at points of crisis. We wanted to influence allocations early in the pathway. We want to look at our different dementia-friendly communities and localities in partnership, and also technology and equipment and adaptations plays a role. Ashley, last slide, please. We also wanted housing considered at all stages of the care coordination pathway, not just at the beginning, but right the way through. And the role of housing strategy. So, for example, it allowed us to influence some new build around disability housing and dementia, and influence the design at St Stephen's. That was really important to us, and it was something that was quite new to me as a practitioner or as a senior manager in HSCP around how we work across and with our partners. It might just be a local thing, but we missed a trick in the past with that work. We would love to influence family care support as a consideration around allocations, and we want to work in partnership with our localities to ensure that we maximise more organically grown support, because some of the best practice examples we've seen have just been that. It's organically grown. It's who is working around the corner, what business is involved, how, you know, what cafes willing to do something, what interests people have, what skills our older people have that they can bring forward into working with us. And so that whole thing around feeling valued in your own abilities is really important in how we look at our older people within our community. And that's about it. Thank you very much.
Debbie, thank you very much. Some really great messages in there. Really great to hear what's going on in Inverclyde. And we've actually got a wee bit of time for any questions or points or anything anybody wants clarified. So I don't see any hands up just now. Ashley, first up.
Sorry to take up all the time, but I think it's really impressive what you managed to do in Inverclyde, and you're talking about all agencies and partners kind of taking ownership and coming together, and at a point in time where probably more so than ever before, all individual departments and organisations are facing their own pressures and their own challenges and their own budgets. How do you get people to come together for that kind of shared goal? How do you get them round the table and create that partnership environment?
I think Inverclyde's a wee bit, it's a unique place. It's quite small, and everybody kens one another. I mean, everybody knows each other, and it's the same faces you see at all the kind of each development theme. It's easy to implement change. I mean, I can tell you about implementing a falls pathway over a biscuit tin with district nurses. It's easy in a small community to do. It's much easier in a small community to do that, and because we're all engaged and bought in, and actually all the key themes They might be sitting in occupational therapy, they might be sitting in adaptations, they might be sitting in housing, they might be sitting in third sector. They've all got that key theme of doing the right thing for our older people, and people have that passion for that. It's not often difficult for us to get buy-in in a small locality like that, when the key themes tend to tip into other people's aspirations. It certainly makes it easier. And the other key theme is money, and how we're all having to be really considerate about that, and just using our that public resource smartly. So it's not difficult. It doesn't seem difficult to me, Ashley, but it might be just because I've worked here for 20 odd years, and you know, I just get to know who to ask or who to support us with different things. But what might be on my key themes may well also help my housing colleagues, or might help my third sector colleagues, or Jill Carson's on this call. I know, you know, some of the work that they do with Alzheimer's Scotland is phenomenal, and it all ties in just to get that right thing. Well, there's Kate Lawson's hand up.
Yeah, thanks, Debbie. Kate.
Sorry, I couldn't help myself but come into my dear colleague of 20 plus years from Inverclyde to help answer that question as well, Ashley. I'm the care group lead occupational therapist for mental health and alcohol and drug recovery services in Inverclyde, and I think Debbie's hit the nail on the tin, which is basically it is about developing relationships. So there's excellent work. There's never been any issue with working between health and social care, particularly within occupational therapy. Debbie and I work on a lot of projects jointly. We're a bit of a double act. And I think when you have that leadership and that joined up leadership of people who are passionate about the community that they're providing a service for, and then it's just infectious. And the work that Jill Carson from Alzheimer's Scotland and Healthcare Improvement Scotland really just bolstered our energies again, to actually focus even more on aspects, and housing was a huge issue, and there was buy-in from all specialities onto Debbie's work plan, and it's ever growing. It's still continuing. We're currently looking at, which Debbie didn't say, but we're currently looking at the assessment checklist and scoring, etc., in terms of looking at housing needs, and dementia really has a heavy focus within that, about considerations of the nuances in terms of people with dementia. And it's not necessarily the physical environment, but it's how the person perceives the physical environment, and some consideration to that. So, but well done, Debbie. Very impressed.
Thank you.
Thank you, Kate. And can I thank you very much, Debbie, and Kate coming in like an advert for Inverclyde. Fantastic. Really good to hear that very local story, and like I said, great messages. We're actually going to head to the other side of the Clyde. Yeah, the other side, as folk in Inverclyde call it. So we're heading over the Erskine Bridge to Western Bartonshire, and I'm delighted to introduce Dawn Connor, who's going to just take us through some of the initiatives that are happening in Western Bartonshire, particularly around that people and place focus. So over to you, Donna.
Hi there, everybody. So just really following on what Debbie said, and putting some of the policy into practice, I'm going to share with you a project that we have delivered as a new build. So we were just about to go on site in like mid-2019 when we decided that we were going to incorporate some dementia-friendly elements of design into our project. So we took some guidance from the CIH notes on dementia-friendly design. We incorporated some of these into this project. So one of the things that made this stand up as a suitable project for dementia design was its town centre location, and feeding into what we've already mentioned about town centre living and 20-minute neighbourhoods. So we created a 22 home development, 16 flats over 4 stories, all with lift access, 5 terrace bungalows, all with their own front and back gardens, and 1 detached wheelchair accessible bungalow. And everything was, and we incorporated our dementia friendly design. So if we can go to the next slide, please. So previously on this site had stood a obsolete 1960s maisonette development, and we demolished that site, and it was our ambition to reinstate a community which had really been lost in the dilapidated buildings. Next slide, please. And this just like this slide, just a little. This was just like the initial artist's impression, where we would slot in a sort of traditional tenement building into the existing town centre location. So one of the main themes of the design was to create a community centred around community and community gardening and security of the design. And so our community garden was always designed to sit right at the heart of the development, and that tenants in the flats and the cottage terraced houses would all have visibility to the garden. Next slide, please. So we've used this sort of theme of gardening to also tackle loneliness and social isolation. About what one of the other speakers was talking about, like finding out what the community wants, and we quickly identified that there was tenants that are relocating from larger family homes with established gardens, and it was going to be a difficult move for them, thinking that they were leaving behind their lifelong garden. And so we've quickly identified a few tenants who sort of started to take ownership of the community garden. And we also engaged with a third-party organisation who would sort of project manage and sort of just nudge the tenants to become more involved. We gave them a little bit of budget for planting and buying all the bits and bobs that you need to establish the garden. After the project was finished, we did some sort of post-occupancy survey, and we got some really nice comments, including the one that I've included here. We're already feeling a sense of community, and we look forward to helping establish the community garden. Next slide, please. So yeah, this is just a slide showing the how from the tenements, from the communal entrance spaces, and from all sort of visible points, everybody has a little view over the community garden, which they can call their own. So it was our priority to connect housing with positive health outcomes and to respond to the challenges of housing our ageing population. So we have lift access to the flats, and level access within the bungalows ensures that the properties are future-proofed, where tenants can remain in their homes for longer as their circumstances change. Next slide, please. So this is just like a little bit of dementia design, where we gave each floor a colour. So every level 1 was all burgundy, all the doors were burgundy. There was clear colour coding as you moved up and down the staircases or entered and exited the lifts. And that subtle design has been very well received. Some of the design that we did in the kitchen was just like really simple things, like taking away a fixed kitchen cupboard door and replacing it with a glazed cupboard door, and that instantly allows you to see what's in your cupboard. We were mindful of using contrasting colours between kitchen worktops and tiled splashbacks or painted walls. We put in place a lettings project, a lettings plan, which, although it was difficult within our allocation policy to allocate to people with a diagnosis of dementia, because our application doesn't ask that question, we wanted the target audience to be to over 65s with mobility issues, because we could identify that, and we were hoping within that we could also just maybe pick up some people with dementia, or perhaps even just tenants that would be at risk of dementia in the future. So that letting strategy was achieved, and because we have this older tenant base, that has definitely helped to create a better community. So this next slide just shows we also created a hospital discharge property. We used a staging company to come in and carpet, curtain, furnish this hospital discharge home, and really just show that, so that we could show that it was a modern house. It wasn't stereotypical of a, say, sheltered housing, or somebody talked earlier about it being an adapted or a house with varying needs to be clinical. And I think we achieved a really nice contemporary look to each of our houses. So these are just a couple of little design features on our wheelchair bungalow with the rise and fall sinks. And this house had electrical charging as well. Just a little bit on the sustainability, and we had solar panels to limit the energy charge. We had some COVID challenges during this project. On the next slide, please. And we managed to get some additional funding. So with that additional funding, we used to create a turnkey development. So when our tenants were moving in, the house was already fully carpeted. It had fitted ovens, induction hobs, because they are a safer appliance to use, and there was a curtain and blinds package in place as well. And we would have liked to have given the tenants a bit of an element of choice around that, but because of the COVID restrictions, everybody's got the same carpet and curtains. And so that made the moving into the property an easier option, and less stressful than what it would possibly have been. So that is the end of my presentation. It seemed to have ended quite quickly. And so from that, so what we've really learned from that is that we've now taken that design and all these little subtle dementia touches, we are just incorporating that as mainstream now into all our new builds going forward. We've got another project that's just about to be complete at Queen's Quay in Clydebank. We have incorporated a lot of the same things. And again, that's a town centre location, and we've put in a sort of similar lettings plan as well. So we're hoping that will create a similar happy community. So happy to take any questions that you may have.
Dawn, thank you very much. Yeah, looks really good, and again, some really nice messages, and some nice messages there from your tenants and the folk who've moved in, and so great to see. Okay, folks, we've caught up on time. So I'm going to open up to questions specifically for Dawn first, but also more generally as well, if there's any questions from any of the previous presenters as well, we can take that too. So Ashley, you're first up.
I've always got a question. That was a really great presentation, Dawn, thanks. I think you mentioned at the start that it was maybe a few steps down the line before you decided to incorporate the dementia-friendly design elements into that build. Did that create any kind of challenges because you hadn't made that decision at the start? Did it add, you know, costs, or would there have been an easier way to do it?
For this project, so it was a design and build project with CCG and with the architects Anderson Bell Christie. And the architect involved in this had previously done a dementia-friendly project for one of the Glasgow housing associations. So because of that, she was quite nimble in just changing some of the designs. The community garden was always part of the project. So yeah, in terms of the costs, the unit cost for this project was £150,000 per unit, and that included £1,300 towards the dementia enhancements, which would probably have been a bit cheaper if we had put in beforehand, because we had to do some architectural instructions just to make the changes.
Thank you, Dawn. And Ashley, good question. I don't see any other hands up at the moment. Oh, there we are. There's a couple going up now. Okay, first up, Keith, and then Nicola after.
Oh, yeah, I can say thank you to all the speakers. It's been very informative this afternoon. I come at this from a slightly different, I come from a health and social care perspective. And one of the things that really interested me was about this avoiding crises. And I just wondered if those who talked about doing planning have any sort of feedback as to whether it does actually change things. Because my own personal experience over the years is that people are very reluctant to move because of things like, I noticed certainly you mentioned hacking, and the actual process of moving frightens people, and people just get very attached to the environment they currently live in. I just wondered if you'd had enough experience yet to say that it actually having an effect on that. Thanks.
Thanks, Keith. Debbie, are you well placed to kick off an answer to that, and maybe bring Dawn in as well, and anyone else too who wants to contribute? Because I would imagine there's a few people with a contribution to that.
Hi, Keith. I too come from Health and Social Care Partnership, so I understand what you're describing. I think what we're planning, and a lot of what we're planning to do, is that around this work is to sow those seeds early, to start to have the conversations wider than just the medical needs or the physical need, to be able to have the conversation of down the line, and for it to be everybody's business. So the housing solutions work is around maybe it could be the first person in a district nurse dressing a leg ulcer and saying to someone, do you know what, this is a big house for you to manage, and where's your daughter live, like all of that kind of stuff. What doesn't catch us up with it, and what some of the kind of where we're not at yet is around allocations, because our allocations policies, certainly what we're able to influence is at point of crisis, and that's some of the work we're doing around looking at specialist housing need and trying to influence that onto allocations policies, because just by the nature of allocations policies, how each organisation work, you need to be able to look at who's in greatest housing needs. And what we're asking in dementia is to move earlier in the pathway. So it's a mismatch for us, but we are trying to influence that in dementia. In terms of, and also for me, there is something around having good opportunities and positive allocations work. So when we do have these conversations around, if you are sitting in a 3 or 4 bedroom house or a 3 bedroom social let, you've been there for ages, your neighbours your pals are all passing away, you're getting a wee bit older, blah, 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 and someone's to offer you a sheltered housing complex in the town centre that's carpeted, lovely, decorated, and you're freeing up family accommodation around that. And it's that big picture thinking rather than it just being around narrow field thinking that we're trying to influence. We're not there yet, but we're having the conversations, and this work is allowing us to start down that path. I've probably not answered your question. Somebody else might have a better. Thank you.
Dawn, did you want to come in on that as well?
Maybe add a few things that we did. So around the moving house conversation. So as we started this project, we put up big signs advertising what we were building, and we put my contact name, and I then started receiving quite a lot of calls, and some of the calls would be like, well, I own my own house, but it isn't suitable for me. And so that was people reaching into me for some housing options advice. We also did a little bit of engagement with the GP surgery, and we told them about this project. We deliver a housing news to all our tenants, and we did a sort of running story in housing news about this project and how we were come forward if you are living in a house that's too big for you, or maybe it's difficult to access. And we also left this, because normally that housing news would only go to your tenants, and so we distributed that in libraries and GP surgeries, where we could maybe get owner occupiers to pick up that information as well. And we did rehouse quite a few owner occupiers in the development as well.
Thanks, Dawn. Ashley, did you want to come in?
Just quickly, because I don't want to take up all the time in this event, and I will talk forever, but just to say that we've got quite a few recommendations in the forum report relating to this. So part of it is about having that discussion and encouraging people to make that positive decision that they want to move and that they're ready to move, but it's also about making sure that there are attractive housing choices for them, and that's not always available in the right place, or the right house that's going to meet their needs. Some people don't want to live in a 1-bedroom home, they might want a 2-bed, they might want a garden. So it's making sure that there's the right range of options for people as well at different points in their life. So there's multiple facets to this issue, and we've covered a lot in the forum report. So there's a lot for us to kind of get on with in terms of implementing those actions. But I think having that initial discussion is really, really important in planting the seeds for making that decision later. But that depends on having the right house to move into as well.
Thanks, Ashley. Hopefully, Keith, that's a bit of a fairly comprehensive response to your question. There's a lot there. Nicola, you've been waiting really patiently. In fact, are you still there? I think we might have lost Nicola, who's had her hand up for a wee while. Let me just check. Yep, I think she's gone, unfortunately. Okay, I don't see any other hands up for questions. Let me just do a quick, yes, there's a Fiona. Fiona, you might be on mute.
Yeah, it's not Fiona. That's a historical legacy. My wife was on a dementia painting course on Teams. I've read the report in fair detail, and one thing that strikes me is missing is the word carer. With most dementia sufferers, there is a carer associated with them. Did this report deliberately set out not to mention carers because the subject was housing and dementia, or what? What is the comment from the authors?
I'll bring Leslie in initially, but I would also direct you to the personas section of the report as well, specifically, but I'll bring Leslie in initially, and Ashley's there too.
In short, it's the use of the term carer, which we try to avoid using, and we adopt care partner throughout, because that can vary from an informal spouse providing care to someone formally providing care. So through the report, there would likely to be reference to care partner. But we were very keen that the lived experience came through in the personas, as Jan mentioned. So that involves both the care partner, be that a spouse or a family member, and the person living with dementia too. So those 3 personas and the journey that they experience and the challenges that they articulate in the report are there to reflect the care partners that we spoke to as part of the consultation, as well as the people living with dementia themselves.
Thanks, Leslie.
Okay.
Ashley, did you want to add to that?
I don't think so. I think that was pretty clear. Just to say that when we were speaking to people with lived experience of dementia, that did cover not just the person with dementia themselves, but families and carers. And we've tried to capture that in the report. So hopefully that does come through. But really, I'm glad to hear your feedback and for joining us at the event today.
Okay. Thank you. Oh.
Thank you. Okay, that appears to be all the hands, and we've just got a few minutes left on this. So I think I'm just going to have a quick look in the chat and see if there's any outstanding questions. And the question from you, Rachel, interestingly, when we about the hospital discharge property, so that space that supports discharge from hospital. When we were at Hanover's Varis Court on Thursday launching the report, they have a similar sort of extra care, and with some more kind of medically based resources in or supports in their property. And we learned about what some of the successes of that is, and some of the challenges as well around sustaining the partnership there. So it's certainly a model that's not unique, and is one that we talk about a bit in the report around that better integration and connection between housing, health and social care as being really vital if we're going to offer people a quality experience in their kind of more general living. Okay, so it's my job just to sum this up and say, first of all, say thank you to everybody, particularly the presenters today. Really interesting, some really strong messages coming through, some nice stories around this too. But also to everybody who's contributed, whether you've asked a question, whether you've made a comment in the chat box. Thank you everybody who participated today. So I think often what happens with a launch of a report like this and living well at home is no different. Is people say, so what's going to happen now, and what difference is this going to make? And I think what we've got is the basis of something that has some very clear recommendations for lots of different people, not least for the Scottish Government. And there's a couple of us here from government today. But also for housing providers, for around health and social care partnerships, around post-diagnostic support, for the third sector, colleagues in Alzheimer's Scotland who both contributed to this as link workers and also will take some of those early conversations about housing choice forward, are very much a part of that. So yeah, this is very much the start of the journey, rather than, we've got the report and that's the end. So we'll continue to work together to push on this, and to use all the input we got from the many stakeholders who were involved and put their knowledge, experience and commitment into making this report real. We'll continue, we will push. We will continue to push with this. So just thanks very much. I don't know if Leslie or Ashley, you want to have a final sign off? Nope.
Just quickly add, Jan, that we'll send the report link and a link to the presentations and to the recording on to all the delegates and anybody who wasn't able to make it today. And if anybody does have extra questions they want to ask, or they feel like they didn't get the answer today, then you can let us know and we'll get back to you on those as well. And just thanks very much everybody for coming along to the event today.
Okay, enjoy the rest of your day. Goodbye.